This is Dr. Ellen Eaton, an infectious control disease expert with the University of Alabama at Birmingham. She's also, by the way, folks, a Dothan native and a Houston Academy graduate. Thank you so much, Doctor, for joining us this evening. Let me first ask you, Dr. Eaton, we've heard a lot of mixed messages from our state as well as local leaders. Some cities in Alabama are passing a mask ordinance. Others don't believe it's necessary, and the governor says it's not mandatory. What's your opinions in regard to the mask?
Yeah, so this is one of the aspects of coronavirus that we've learned a lot about over the last few months. If you remember, early in March, we were really focusing on surfaces, frequently touched doorknobs, desks, countertops, and disinfecting those surfaces. And what we've learned over the last few months is that most of the transmission is actually not happening from contacting surfaces, shaking hands, sharing computers. It's actually more from shared space, shared air, and droplet transmission. So that's why you've seen the public health community really emphasize mask use anytime that we are indoors, crowded settings, waiting in line at the grocery store, and even in workspaces that don't allow you to appropriately distance yourself 6 feet or more from others. And certainly if there's any situation where there's poor ventilation, crowded environments, you want to have your mask on. And we feel very confident. The Infectious Disease Society of America has come out and said that they feel very confident that even cloth masks can prevent a lot of the droplet-related transmission that we see, even from speech, but also from coughing, singing, sneezing. We think the cloth masks are very effective.
So do you think that some of our elected officials perhaps have dropped the ball as far as not making it mandatory to wear masks in public especially?
Well, I will say that there has not been a clear and consistent message from leadership. Part of that is that this is a novel coronavirus, as I mentioned. We did not know the importance of masks early on. And then when we did realize masking was so beneficial, I think the community was confused and there was not really a clear, consistent message from leadership. And even some of the public health officials, I don't think were able to advocate for the masking early as possible. And I think that's been very confusing for the community.
All right, Dr. Eaton, thanks so much for joining us here on WDHN, especially being a Dothanite as you are. I'm sure that maybe you have a specific or feeling for this area here in the Wiregrass. All right, thank you so much for joining us.
Thanks for having me. Stay well.